More and more kids suffer from concussions and bone injuries. Recent discoveries on how our bioelectrical body really works are bringing new solutions to the table. You're listening to the 2025 EMF Hazard Summit. My name is Nick, the EMF Guy Pineault, and this is the EMF Hazard Summit, Protect Your Children. In this fascinating presentation, Dr. George Roth reveals new scientific findings around bioelectricity that highlight the importance of treating concussion and bone injuries very early as they happen. Dr. George Roth is recognized as an authority and pioneer in the field of physical medicine. He is the developer of a breakthrough system called Matrix Repatterning, as well as the Safe Zone EM device, which you'll hear about during this interview. Let's jump in. I'm here today with Dr. George Roth. How are you, George?
I am very well. Thank you, Nicholas. Nice to see you again.
Nice to see you again. We connected a few times before, and for people that are not familiar with your work, what is your professional background quickly, and how did you end up starting to appreciate the impact that EMFs can have on the human body?
Yeah. Well, my background is now for almost 50 years in practice as a chiropractor, naturopath, and osteopathic practitioner. Studied in Toronto in the U.S., so Canada and U.S. And I discovered some issues that showed up as bioelectric signals in the body that told me where injuries were, which was just sort of a happy accident that happened over the years. But then within the last 10 years, I started to notice that these signals were significantly impaired. I was unable to detect them as easily. And also, we were having challenges in treating. And again, just by accident, I realized it was caused by interference from electromagnetic pollution, Wi-Fi, smart devices. And I quickly scrambled because I've been teaching this for a number of years up to that point. And me and the other practitioners using my techniques were suddenly having great difficulty. And so as a result of that, I came up with some strategies and some technology, which I'll talk about as well, which have been transformative for our practice, but then turned out to be quite a benefit to people who started using them in their homes. And so we can talk about that. It's been an exciting journey with ups and downs, but I think that's something that I'm glad I have the opportunity to share with you today.
Yeah, and something that you made me appreciate. We met a few times, and I did experience your matrix repatterning. I'd say framework that goes way beyond what I experienced from chiropractic before. You use magnets, for example, and I know that you have found, let's say, new ways of looking into the bioelectrical properties of the body in order to restore structural function. Can you talk about some of these case studies that you showed me? Because I think that they're especially impressive of what you found in certain children that had, for example, concussion you mentioned before the interview.
Yeah, for sure. I think it could be easily illustrated with a few slides to give you some background.
Sure.
Okay. And I've shared this with you, some of this material before, and I think for your audience, it might be helpful that we have a look at that background. So it's a long history. So basically, the idea here is that the body is a bioelectric transmitter, conductor, generator. And so when we are now living in a world that is being altered bioelectrically, electromagnetically, we are all experiencing some of those detrimental effects. And this is really key to how I unraveled some of the mystery of how the body was affected by injuries. So something that happened many, many years ago, this is almost 50 years ago now. So I was a student at the chiropractic college and studying dissection. And I started to notice that there were significant differences on one side of the body versus the other in terms of bone structure. This was further confirmed by looking at x-rays And no one could explain these differences. And little by little, I started to put together, some of this information and realized that these changes were happening within the skeletal framework in the bone structure, which no one had talked about. And noticing, for example, one shoulder bigger than the other, the ribs being depressed or deformed on one side, changes in the lower extremities and the legs and the knee. All of these things started to show up. And at first, I didn't know what to do about it. But then I started studying osteopathy and other techniques and realizing that there was something going on within the deeper framework of the body that happens all the time due to injury. So one of the things I talk about is the fact that we are subject to the forces of nature and especially gravity falling on our different parts of our body, the knees, the wrist, the shoulder, and even the head. And these have significant effects because bones are very, very dense. They absorb that energy and they actually are changing because of it. So I basically developed the technique around this idea that maybe we could change bone. And lo and behold, we were able to start changing the structure. And these issues were starting to actually be measurable. We could see differences in the size of the bones. Other students, practitioners from around the world that are now using these techniques were able to measure those changes before and after treatment. And when that changed, everything else changed. The joints started working better. The spine started to improve. Organs started to work better. And it's amazing, but this is now being verified by research, confirmed. This was just in 2005. Studies at the University of California actually confirmed exactly this, that bone enlarges with injury. This is impact using high-powered microscopy, okay? And so when this expands, it changes the bone, and even after the injury, it stays enlarged. It's larger than when we first started. So down here, you see enlarged bone. It expands dramatically during the injury, and this was the original size up on top, and this is what they were able to confirm in 2005. So my observations were actually verified at that time. So it was quite gratifying to realize that. Another big part of what we realized is that every part of the body is interconnected. And I had the happy fortune of meeting Dr. Stephen Levin, an orthopedic surgeon, in 1992 when I was developing this work early on. And he started to recognize that there were significant structural issues in the body that he identified as biotensegrity. So Dr. Levin basically started to explore this. We taught together for quite a number of years. We still interact quite a bit. And then this was also confirmed in later by a cell biologist, Dr. Donald Ingber at Harvard University, who looked at the cell structure and realized there is this structural framework in the cells and between cells that determine exactly how it works. And so when you have an injury, this cell structure is altered. We call that a primary restriction. And so if you look on the left here, this is the cells and the fibers between cells. All of these change shape when there's an injury. And in bone, it's especially evident because bone can't get rid of that energy. Bone stores that energy and literally changes shape. So if you bang on a table, for example, you bang on it, you can hear it clearly. If you bang on a pillow, hit it with a hammer, you don't hear anything, it doesn't absorb the energy. And you won't see any evidence of injury on a pillow, but you might see it on a desk or a table if you bang it with a hammer, right? So this is illustrating what happens to an injury, let's say in the femur. And I'm sure many people have experienced this, falling on the hip. So you see this we actually can measure this change. The bone expands, and that results in changes to the bone. It expands, it pulls on all the fascia around it, but because it's connected through this framework of the body, we call the biotensegrity matrix, it creates mechanical stress that is then transmitted to different parts of the body. It can cause neck pain, shoulder pain, knee pain. And the big challenge was, where are these symptoms coming from? And people are chasing symptoms. And I said, no, there's got to be an underlying reason for these symptoms. And lo and behold, we were able to find those areas. And what was interesting about that is we were actually able to measure them electronically. Okay, so we started using pulse magnetic field devices early on. We could actually pick up these changes, but originally using our hands. But it's understanding how the cells work electronically. And so what we have is ionic charge, different ions, sodium to potassium primarily, that are constantly being bounced across the cell membrane. And this generates voltage. This is basically every cell in our body is a small battery. And, the idea that we could get away with walking around with all these trillions of batteries in our body, and we think we can go into an electronic field that's not the same frequency, it's like, we have got a problem. And guess what? We did develop a lot of problems. And so this is why we can pick up electrical charge from the heart using electrocardiography. We can see it with brain impulses. We can pick up the electrical signals in muscles and nerves. All of these things are affected. But what happens when the cellular batteries change shape? And that's a big, big issue. And that's why we connected injury and all of a sudden an alteration in the electrical properties of the tissues. And that's what we were detecting. Okay, I didn't realize that until later on, and especially when we started to get the interference. Okay, so as a result of that, there's more studies that have just come out. For example, that bone is extremely bioelectric. This just came out in 2023. The bioelectric properties of bone was published, and they're showing a close interaction of what happens within bone structure and all of the cellular mechanisms that affect its electrical properties. And other studies have shown that when it's injured, when it's deformed, it totally changes those properties. And this exerts a profound influence on its metabolism, homeostasis, regeneration, and health and disease. And they recognize this in this study by studying bone very closely. And so we have to recognize that bone is a powerful storage of electrons. And when it changes shape, those properties are altered and it's mechanically affected. And so injury, especially with bone, changes it, and because it changes the structure, changes its electrical properties. So we were able to detect these bioelectric changes in the body using various forms of technology. And one of the devices we were able to develop is based on a magnet that's called an alternating polarity concentric magnet, which actually produces a form of electromagnetic field that stimulates microcurrent in the tissues. We didn't realize this initially. We knew that it was helping, but we didn't quite understand the technology behind it. And so over the last 7 or 8 years, we've been able to develop this technology further. And scientific evidence using magnetometers have shown us that there is a form of cascading electrical signal going through this magnet that stimulates the body. So we know it helps with pain and tissue repair, but it also has been shown to help us figure out where these injuries are within the body. And as I said, there's double-blind studies to support that. Now, because of that technology, we were able to apply that to our assessment, because when you apply this type of magnet to the body, it actually turns the switches back on, the electrical switches back on, which has helped so many people with pain, but it also tells us as practitioners where the problem is coming from. And we can use that to scan the entire body. And we basically, because of this interconnection between all of the different parts of the body, we can actually detect that anywhere. And one of the things I've told people before, if you want to know how the body's interconnected, just take a moment, and I suggest people try this if they want. Close their eyes, notice how the neck and shoulders feel, and then clench your fists and notice what happens to the tension in your neck and shoulders, and then relax your fists. Do that on and off a couple of times, and you'll see how that when you clench your fist, it feels tighter, right? And through the whole body, but you can actually feel it clearly in the neck and shoulders. It's a very sensitive area. This gives you a simulation of an injury, which is represented by the fist. So that's why an injury in one part of the body feeds through the entire body. But in order to find out where the source is coming from, we needed to find this technology. And that was great. It worked really well, right? Until it didn't. And the problem was we encountered interference. Okay, so we'll talk more about that in a moment. So then we were able to apply that to treatment, because not only did this magnet find the injury, it actually improved it, okay? Because it actually is therapeutic. And so we can use that with gentle pressure. That's what matrix repatterning does, literally changing the shape of bone. It's incredible. And when it first happened to me, I was shocked. Many of the practitioners I taught, this idea of gentle pressure, we call containment. Entrainment is using a biocompatible electromagnetic field, which the magnet seems to develop. And so that combination was profound in its effects. And we started to notice bone changing. Fortunately, a number of years ago, we had this wonderful opportunity. A young hockey player who was really in bad shape. His parents noticed that at 15 years of age, he was hobbling up the stairs. And they took x-rays, very careful x-rays, which is unusual because he had a genetic bone condition that they were worried about. So they were very precisely measuring the size of his knee, all right? And after 3 or 4 treatments, they were shocked because the bone literally shrank to a normal size. And literally, they were able to measure this change. It was a full 5 millimeter difference in size. And not only did it shrink in size, the joint actually improved. You can see the joint here is open. Here it's closed on the left side. It's opening here. And his parents' comment was now he was flying up the stairs again, able to go back and play hockey.
Wow.
But this is the kind of thing that we just knew was happening from a clinical point of view. And now X-ray evidence has shown and supported that. Another powerful opportunity here, we had one of our practitioners treated a young girl who had a terrible fracture in her tibia. It wouldn't heal for 5 years. They had to put a metal rod in, as you can see here. The bone started to deteriorate. They said there's no hope for this. They tried everything, bone stimulators, everything to try to heal it. It would not heal. This was going on for 5 years. You can see it from a view from the front and from the side. The bone is just completely broken down. This young girl was hobbling. She had to use a walker at the age of 15 by the time she was seen. The injury happened at age 9. This is after 6 treatments. Normal, healthy bone using matrix repatterning. And it was amazing. Her parents were shocked. The surgeons were shocked. They'd never seen anything like it. The rod has now been removed. This is about 3 years ago. She's functioning normally like a young teenager. I think she's 18 now, and she's doing great. And this is something that's so significant. And the opportunity to see that visually and verified that this actually can occur. Okay, it's very profound because these changes in bone affect everything else. It changes the internal organs, the joints, and even the brain, as we'll talk about in a moment. Okay, and so when we say when we're repatterning, is we're restoring the cell structure, we're letting the puzzle pieces fit back together the way they're supposed to. It removes the biomechanical stress in the joints, reduces pain, and it improves cellular communication. We know that because we see improvements in brain function through EEGs. We see improved laboratory evidence, improved liver function, cardiac function, and so on. And if you don't correct that, the problems keep returning. So matrix repatterning has been shown to restore all that, the ideal size and shape, improve biomechanics, the bioelectric properties, and intracellular communication. And really, it's about helping the puzzle pieces fit. So many practitioners now, medical doctors, physiotherapists, chiropractors, and occupational therapists and other practitioners from around the world are now using this technology to help so many people. We're so gratified. We just started teaching this in Europe. We have practitioners being trained in Germany, the Czech Republic, Ukraine, and also Australia, New Zealand, all over North America. So they are seeing these changes. And so many of these solutions now we've been able to achieve for all kinds of conditions. And I won't go, there's a long, long list. It keeps growing because when you normalize the body heals itself. We're just supporting that. It's magic. It's the magic of the body. I was gifted with this opportunity to discover these basic principles, but they've been put to the test. They've been verified by other practitioners, and they're used to help so many conditions, from snoring and sleep apnea to organ function. I work with dentists as well who've had significant improvements in issues with dental pain and so on, chronic pain. And we want to talk a little bit about this big issue that we're seeing more and more of nowadays in all kinds of activities, and that's concussion. Mm-hmm. And this is an area that I've been exploring for quite a few years. And these same bone changes are taking place in the head. And it's rare. If you have kids, I have kids, it's rare that you don't see a little toddler jumping and off of things and bumping into furniture and hitting the floor. Sure. It starts from day one. And even before that, in the womb, sometimes we see these changes during delivery. These are altering the shape of the skull and therefore affecting the mechanics of the nerve supply, the blood supply, and so on. And we know this is happening. It's a measurable change. And what's beautiful here is we can actually change that shape. And one of the researchers who's been looking at traumatic brain injury for many, many years, Dr. Norman Doidge, started investigating our approach to treating concussions and wrote about it in his recent book. He wrote originally The Brain That Changes Itself. And then in 2016, he published this book called The Brain's Way of Healing, where he talks about matrix repatterning. It was actually originally the longest chapter in the book, but the book was cut in half, it was too long, but he insisted on having it in the appendix. And so there's information about that. We see people, because of his best-selling book, people with concussions and brain injury from around the world. And so his comment was that everyone should have an assessment done with matrix as soon as injury to the head occurs. And he's seeing this happening dramatically in front of his own eyes, how quickly it can change the functioning of the nervous system. And his comment was it should be in emergency departments. And that's what we hope one day it will be. And more and more medical doctors are taking the training as well. And we have a Canadian medical doctor now who's investigating, introducing it to the medical profession. So we're hopeful that's going to develop. So these changes in the shape of the bone of the head are quite dramatic. So on the left side here, this is an example. I took a quick picture before and after one treatment of a young lady who came in because of injury that she'd had to her forehead. On the left side here, there's a little bit of a flattening of the skull. And this is before treatment. And then after treatment, the shape of the skull, you can see the roundedness of the eyebrow here, the flattening on the left here. And so this basically changed the shape of the head almost instantly. And we see people with neurological issues responding very, very quickly because of that change, because you create a better environment for healing, right? And we're seeing a lot of babies now, a lot of infants. So this is a young child. I took a picture of her just to have a quick look at the shape. This is often happening in the womb, sometimes during delivery, but often in the womb, the baby's head is pushed up against the pelvis, changes the shape of the head. And this is before treatment. And this is just one treatment later. You can see the roundedness being restored to the head. We see babies who are not crawling properly, who are having difficulty latching for nursing, improving almost within days, if not sooner. And it's a significant change in these bone structures, which alters the way the nervous system works. And I think any parent should consider what is happening very early on to their children when they see these injuries occurring. Start noticing what's going on with them, because their behavior, their sleep patterns, their cognitive function, and even motor function may be impaired. And if you're not paying attention, you may miss this. They may have difficulty reading or hearing. You might notice their hearing is diminished. These things happen very, very quickly, and they are reversible. So concussions in children are just a very serious issue. We see a high percentage of children in sports and other activities suffering from this. The percentage of children age 0 to 17, this was in 2020 in the US, it's roughly 7% of children have significant enough head injury to basically be categorized as a concussion. And you can see as they get older, they're involved in more dramatic contact sports and so on. That percentage is going up to around 12%. And that's a lot. Those are the ones that have been diagnosed, by the way. In my opinion, it's more like 30 to 40%. Okay, but they're undiagnosed. Jeez. They don't connect what's going on. It's very, very serious. So one of the things we have to look at, what happens in the brain, okay? A protective layer within the brain and around all the nerves is something called myelin. This is a fatty substance that develops around the nerves and around the brain. But what's important to understand is that this tends to develop slowly and doesn't fully integrate into the protective layer that it should in the brain, especially until the mid-20s. And this is affected by injury. We know this is altered. The entire nervous system is, the cell structure is affected. So the question is, how much is this affected, all right, as part of it? And since the myelin is not fully developed, okay, in young people, and then we have a big concern. Every time I see this, my heart sinks and I get scared. When I see young people with these ear pods in, I know based on our experience with how electromagnetic fields were interfering with our work, I started to realize there's a big, big problem here. Okay. And so about 10 years ago, I started to realize there is more and more interference occurring due to electromagnetic signals that are being generated in the environment. And so the question is, could myelin damage be part of what's causing electrohypersensitivity? All right. And this is a study that was done that just came out in 2014 from Monash University in Melbourne. And they speculate on the effect on myelin of these electromagnetic fields. And they notice that there's a possible deterioration due to the electromagnetic fields on the myelin, causing it to deteriorate, which reduces its protective function and can make electrohypersensitivity more prevalent. So people with concussions are much more sensitive to these electromagnetic fields as well. So that's why looking at what we're doing with matrix repatterning and how that can also tie into the importance of what's going on electromagnetically in our environment is a crucial piece of the puzzle here. Okay. And so the most vulnerable are young people. All right. And this is from the study that was done at the University of Melbourne. And it was likely in utero and at least until the mid-teen years. Again, because of the poor development or lack of full development of this myelin protective layer. And so here we are now. We're living in this electromagnetic world. And guess what? We're supposed to be living in an electromagnetic world, as you know. And one of the things I looked at years ago is, what can I do to limit or prevent this influx of electromagnetic pollution interfere with the work we were doing? So I speculated years ago, well, maybe if we increase the Schumann frequency, which I knew was in decline. This is in decline due to a cyclic reversal of the magnetic poles, which I've talked about. Many of your guests have talked about as well. This is really important. At the same time, as we're seeing a rise in electromagnetic pollution, we're seeing a significant decline in the electromagnetic field of the Earth, which is very, very important and very protective. And so this is going to accentuate the harmful influence of electromagnetic pollution. And what we now know is that our health depends on our electromagnetic environment. Every cell in our body living in this field is literally depending on this source of energy. It's like we're a battery, and we're in a battery charger. We're a rechargeable battery, and our battery charger is the Schumann frequency produced by the Earth. And that's what I started to realize. I got to do something maybe to counteract it. So I came up with some crude ways of improving that. I realized the Earth was producing these frequencies. Guess what? We need to look at that because the brain waves are identical. All right? The Earth's frequencies and the brainwave frequencies are identical all the way down the line. And so this is why we have to pay attention to what's going on and why this is becoming such a serious issue. All right, so I came up with a possible solution many years ago, a very crude form that I first started off with, and we call that the safe zone, okay? And so this is something I created for our practitioners only, all right? Something that was able to help them improve their outcomes. They were able to pick up the injuries, able to treat people, despite the fact that they were getting electromagnetic interference. And literally, it worked like magic. And then one fine day, one of my students, a practitioner, lent her safe zone to her friend, whose son had been experiencing epileptic seizures since the day he was born due to a brain injury. And I've talked about this to you before. he had been experiencing 10 to 20 seizures a day for 17 years. And she lent him her safe zone. Within 24 hours, he stopped having seizures. He's practically had no seizures now for, I think, 2.5 to 3 years now. And that was using our very, very first, very crude device that I developed literally with a local technician. And so it worked really great up until about January, I believe it was January 2022. I forget what date, but it was like clockwork. It was in Waterloo, Ontario. It was a big university town, and they cranked up the 5G signals. And almost instantly, his seizures started coming back. The mother, who'd been suffering from ringing in the ears, tinnitus, for 20 years, who had gotten relief with the original Safe Zone, all her symptoms came back as well. And around that time, I realized we had to develop this technology further. And thankfully, within about a month, I got her the new version, much more powerful version of the Safe Zone. Everything went back to normal. And this is the technology we now have available that is, and because of seeing improvements in people with chronic headaches and sleep disorders and anxiety, and I know you've experienced it to some extent, we talk about this because it is something that is really important. We have to support the body's natural electromagnetic frequencies. And I believe just by chance, this device has helped other people beyond what I thought it would just help our practitioners. And so I've been shocked and delighted that it has been able to do that. So what I decided a while back is because the Earth's magnetic field fluctuates during day and night, I realized what we could do with this device is we could mimic that. The Schumann frequencies actually drop down to a lower level at night. And then as the sun hits the ionosphere and changes the shape of the field around the Earth, where the Schumann frequencies are generated by lightning strikes around the world, that frequency increases, which causes more awake cognitive effects. So we can actually reproduce that same pattern by creating a natural system within the Safe Zone that you could set as a timer to work differently during the day and the night. And so those cycles have improved tremendously. This is very powerful technology, by the way. Some of the devices I've tested out there are, quite frankly, not what they claim to be. I've looked into every device out there. Our technology has been tested and proven to actually generate these cycles. I have a picture of Nikola Tesla there because I actually stole his Tesla coils to be able to create a broadcast signal into the field. The Matrix Mag technology, the same technology is also connected to this to boost the signal. So it's been an incredible journey of discovery, figuring out the best signal, how we can coordinate them. And then ultimately, we wanted to research it. We wanted to get researchers involved to be able to verify this. And one of the first people I contacted was Magda Havas, especially because we started to see these changes in people with epilepsy and other even things like ADD and autism and so on. And so she basically got involved early in the research. And also Norman Doidge was excited because he was interested in brain function. And so he got involved as well and has been looking into this with us. And then he connected us to Dr. Ryan Darcy at the University of British Columbia, who had developed a form of electroencephalography called the NeuroCatch. And so that device now, we've been using that to develop research to measure people's responses to the Safe Zone. And what we've been gratified to see that in those people who are electrosensitive, the Safe Zone has shown a significant improvement in cognitive function as measured by this device. And what's interesting is typically they see a decline in function when people are tested back to back with this. Okay, so this is Ryan Darcy, and the method we used was to test the safe people in the field produced by the Safe Zone and then without it back to back. And typically what they had found is that people who had back-to-back testing got worse. The second test, they saw a decline. They were shocked when they noticed that people, when they did the second test in the presence of the Safe Zone, the subjects did not know what was going on. They just knew they were doing two tests. They didn't know the Safe Zone was off for the first test and on for the second one. And so they had an improvement, which was a surprising outcome. All right. Increased speed of processing, reduction in the noisy brain, the amplitude of these signals as well. And so these are outcomes that we were able to track, looking at, you see here, the blue graph measures people without the safe zone. And then with the safe zone is the green line, which indicates it's come back into a normal range. And these were repeated again and again with different test subjects. The blue again being without the safe zone, the green with the safe zone. And in several cases we used as well, we tested people without the safe zone in both cases, which is often both. And then we tested the same test subjects, testing them before and after. And again, you see an improvement with those people. But it got worse in the case of testing back to back, which was typical before that. So this is starting to develop this research has been a big challenge. So we are continuing to gather data. And so ultimately, we now have a device that seems to be helping many, many people. All right. And so it's creating these Schumann frequencies in the normal range, which are occurring day and night. It's like a natural alarm clock. You can set the timer when you want to wake up, when you want to go to bed. So these frequencies then are generated by a powerful transmitter, which sends it out into the home or the office into a large radius. And we can detect these out into a large area, up to 4,000 square feet. There's two different devices. One is the standard, which is roughly 2,000 square feet in diameter, a signal, and then the plus version up to 4,000 square feet. But this also depends on the level of electromagnetic exposure. Some people have found that if they have a lot of signals around them, or they can't avoid being near towers, cell towers, and so on, a plus version may be necessary for them. And so, we give people an opportunity to experience it. They have a full 90-day or 3-month trial, so there's no risk at all to trying the device, see what works best for you in this situation. And if it doesn't help, it can be returned, So we stand by it, and this is something, we've talked to you about before. But this is very important to consider as a possible way to counteract the effects. It doesn't take away from all the other things that you recommend to minimize your exposure, to improve your general health. Turn your stuff off at night that you don't need. You do Ethernet cabling or wiring to avoid Wi-Fi within the home. Limit your exposure as much as possible, but you can't always do that, especially in a condominium. I know you have that situation, people living in offices or working in an office. It's really hard to avoid. This is where the safe zone, I think, could help other people. So the benefits have been, it helps mimic the Earth's frequencies. It's reduced many symptoms, including headaches, anxiety, sleep disturbances. We've had people and dogs who've had serious skin irritation, especially with the 5G introduction, who've stopped having skin irritation, people with seizure activities, and so on. And the important to recognize that the safe zone does not block the electromagnetic signals at all. It simply compensates for them by producing a more biocompatible signal that basically all life on this planet is based on. Okay? Like I said, I had to develop this because of our work being interfered with, but then realized that many people were benefiting from it. So that's been very gratifying. So that's why we can say life is better in the zone. And for many people, it seems to be the case. Anyways, just to wrap up here quickly, this same technology, by the way, an early version of this, one of my students actually was using it because we only had it for practitioners, but she noticed when she took it home, her dog didn't want to go anywhere away from it. And literally would go to sleep with his head on the this is an older version of it that we first developed. Excuse me. And it's interesting. I got a couple of pictures from a recent user of the Safe Zone. Her dog is Barkley, which is a funny name, but he would never sleep anywhere but on his comfortable bed at night. Okay. But then as soon as she put the Safe Zone in, this is where he's sleeping. Near the Safe Zone. You can see the Safe Zone up here. That's where Barkley wants to be. Animals, cats have done the same thing. they recognize that this is life-giving and supportive and makes them calm and relaxed. This is how they respond, So animals don't lie, right? There's no placebo effect. So the same magnet technology we've also had available for people to use at home. So this is something we've been happy to offer people. The same technology that we use in the office is a form of it that's available to people to apply to painful areas, low back. We see many people low back issues, chronic degenerative changes, and so on. This technology has helped so many people. And so we now make it available in a home version as well. And so this shows you a few examples of how to use it for the low back, people with concussions and neck issues, the knee, and so on. There are different ways to apply that technology. And we've been also developing more technology based on this same thing. The Safe Zone includes that technology. And then with the other products we have available besides the home treatment kit, we also have wristbands that can be worn. People who've actually had electrosensitivity wearing these devices either in a wristband form or a pendant or attached to their phone have found that it helps to counteract the effects of electromagnetic interference too. So that was a surprise to me. Actually, it was the woman whose son had epilepsy. She clued me into this. She noticed that when her son went to her father, who did not believe in any of the electromagnetic stuff, he had computer banks and all kinds of stuff. Her son would come back and be in post-traumatic stress for 2 or 3 days after coming back. So she decided to secretly sew these magnets into his clothing. And so when he came back, he would be a bit upset for about an hour or two instead of 2 or 3 days. And so it seemed to really help. And people have commented on that. They found their headaches are improving, even just wearing it as a wristband or a pendant. So it's surprising. But when we look at this technology, actually, there's some evidence that it's very ancient technology that goes back possibly even to ancient times. All right. So like tracing it back. So anyway, so this technology is available. Matrix Repatterning is something that we encourage you to look into. You can check our website at matrixrepatterning.com. You can contact us. The other devices, the Safe Zone, the Matrix Mag, there's information you can get on our website, wellnesssystems.com. And I know, Nick, that you've been, supporting this and you have it available to your audience as well. And so you can talk about that. So I will stop my slides there.
Sure. Well, all the links going to be under the video. How I see, all this fitting in the EMF story is really that the more disconnected we've become from our natural environment, and the more we're adding artificial frequencies in, the more chaos our body experiences. And the same thing is true for our children, except it's even worse for them as they are not myelinated. They're still developing their brain. So the technology you've created and the Biomatrix also, in a sense, both contribute to restoring normal bioelectricity in our body. So I think it's brilliant. I've had great feedback from my community from your product, so that I'm very happy that you presented this in the EMF Hazard Summit. I know this is something very cutting edge, and what I'm especially hopeful for is that since you're working closely with let's say more mainstream scientists such as Dr. Deutsch and others, is that we can have more and more evidence around these products, so that way we can expand how many people can benefit from these different technologies, including the Biomatrix the Matrix Repatterning, which I've experienced myself. It really helped me, change the way I move, but I can only imagine how profound it can be, that technique, and when it's applied to children. Because if you have dysfunction when you're 5 years old or 15, of course, that dysfunction can get even worse, and you end up as an adult that is in chronic pain, or you have a limp, or there are other functions that are simply not working. So it got my mind spinning again. Each time I talk with you, I learn something new, and I'm very, very grateful for your presence on EMF Hazards 2025. Do you have any parting words for parents that you want to share?
Exactly. I just want to, as a parent, I really feel that the sooner we can intervene to support our children's health and development, recognizing that injuries are very common and electromagnetic exposure has been shown to be detrimental. And the sooner we can intervene and support recovery and improving the environment for them to develop in, the more likely we are going to protect them from the detrimental effects of cognitive decline, of neurological dysfunction. And, many parents are now recognizing the increase in ADHD, ADD, autism. This is one of the factors. There are many factors involved, but this is something we can do something about by getting them checked, getting their structure improved by consulting with a Matrix Repatterning practitioner. That's available on our website, and also recognizing the possibility to improve their electromagnetic environment through many of the technologies you've been exploring. So thank you for your service, Nicholas, because you have brought this, to the attention of the world and to your community and to all the parents out there. So I wish you all well, and I'm here to support you in your effort to support your health and the health of your children.
Thank you so much, Dr. Roth. It's been really lovely.
Thank you.
I really hope that you liked this presentation. If you want to take action on what you just heard, you'll find links to everything that was mentioned by our guest speaker right underneath this interview. If you love this summit and want to own the recordings in audio, video, and written form for all of these 2025 interviews, make sure to click the buttons on this page to get the 2025 EMF pack. This EMF pack is heavily discounted during the summit launch and for a very limited time. Remember that every purchase supports my work as an independent citizen journalist, as well as the nonprofit partners that are associated with this summit. Thank you for your attention and support, and I'll see you in the next presentation.